Production and distribution of
Peace. It's good to see y'all. If you haven't
Setting up our next episode.
Battery 80%.
What's up? Joining in.
all
Gab,
right,
how you
all right,
doing,
all right.
brother?
What's going on?
Chilling, man. Chilling. You know what it is. Let
Already.
me post this comment on here. Hello, people. Hello, beautiful people.
Everybody.
How do I post it? There we go. Let me. All right. I'm trying to hit the pin. There we go.
Hold it.
There we go. I got the pin going.
All right, all
I
right.
got the pin going.
You want to get started? Let's get started.
Sure.
All right, what up, everybody? My name is Gavin Webb from STOOP55. I'm joined here with my bro again, Dr. Cooper.
How y'all doing? At it again.
At it again. He's the Director of International Emergency Care at a hospital in New Orleans currently. And this is From the Front Line, another episode where Dr. Cooper is going to be taking your questions and answering them, talking to you about the latest on the public health issue, and talking to some of our guests. Today we have Katie McFadden, who is a healthcare justice activist, as well as a registered nurse, formerly employed at SUNY Downstate Hospital in Brooklyn, New York. She worked in the neonatal intensive care unit. We also have the pleasure of having Farah Forrest, who is also a field nurse from Brooklyn and in the runnings and a candidate for the 57th Assembly District position in Brooklyn. So really happy to have them on today. Before we get started, I just want to remind everybody the dot. We have a PPE fundraiser where we're raising funds for the production and distribution of N95 masks to Brooklyn Hospital. So if you guys can help, we would really appreciate any donations. Please hit the link in our bio. So yeah, man, kick off today's show. Dr. Cooper.
What's up, brother?
I would say, you know, the COVID-19 pandemic it's brought attention to a lot of needed reform in multiple institutions and systems in our society, whether it be unemployment, mass incarceration, education, obviously healthcare. Moving forward and, you know, with the effect of COVID-19, how is the healthcare delivery and systems in our country going to change? And, you know, being in an election year, what do, you know, voters that can sort of help push policy, what do they need to know in these times?
Yeah, so right now it's really all up to us in terms of making change. I don't see anything that's on the docket right now, but as some politicians are starting to think of it, you know what? We're seeing the glaring disparities in health between people of different socioeconomic classes, and us as a nation really have to be held responsible for creating the system. Not only held responsible for creating the system, but creating the change that will end up benefiting everyone right now. I personally think it's going to lead to an expansion of health insurance. There are too many people that are either uninsured or underinsured. I think we have to expand Medicare, Medicaid way more than it is right now. Even now, you already see Biden starting to take a little more of the policies and thought processes of Bernie, just to get more of the liberal side on board. But beyond that, I think that's what's needed for the country in a lot of ways. So as citizens, forgetting myself as a physician, obviously I can advocate for my patients, But as citizens, I think we have to think about it and go to the polls with that in mind, saying we have to. I know a lot of people don't like the thought of hearing socialism or something along those lines, and also have a bad taste in their mouth comparing it to Russia or Venezuela or something along those lines. But we have to have more responsibility for these people that are suffering, because either loss in job wages, loss in jobs, or just not having access to health care. I think a lot more preventative care and primary care will be forced on us, and that's what's really needed.
Okay, fair enough. I appreciate that. I'm looking forward to hearing what KD and Farah has to say when it comes to those issues. Sir, I appreciate you.
Always, brother. Nice seeing you.
Nice seeing you as well.
All right, y'all. So I am more than excited to bring on someone I personally call a friend. She was a former registered nurse in Brooklyn, now a community activist in Brooklyn. Welcome, Katie McFadden, as I actually, flip the screen. Flip the screen, y'all, my fault. Let me bring you in now, Katie. There we go. All right.
Hi, everybody.
Hey, what's up, Katie? How you doing?
I'm doing well. Thank you so much for having me today.
Thank you so much for coming on. We really wanted this episode to be a different perspective, getting more into the policies and politics of the effect of this COVID-19 pandemic.
Mm-hmm.
All right. So do you mind first introducing yourself to the people and what you do?
Sure. So my name is Katie McFadden, and I worked as a nurse in the neonatal intensive care unit at SUNY Downstate Medical Center from 2014 till 2019. And for context, for people who aren't from Brooklyn or aren't from New York, SUNY Downstate is a public hospital where over 90% of the patients we were serving were Black. And the kind of what I realized, what I didn't know until I was working there, was that Black babies in New York City are 3 times more likely than white babies to die before their first birthday. And when I heard that, working in the NICU of a hospital where all of our patients were Black, I was like, oh my God, those aren't some babies out. That's not some statistic. Those are the patients I'm caring for. Yeah. So what is going on? Like, what's going on essentially at our hospital that is contributing to this phenomenon? And why didn't I know that this was, why didn't I know that this was going on? Why can't I explain it? And what is exactly happening that is making the patients I'm caring for so much more likely to die before their first birthday? And what I discovered was that it has a lot to do with the policies we have about how we finance healthcare. And when it became clear that because the issues we're having were like policy things, there wasn't a lot I was going to be able to do about it as a bedside nurse. I resigned last April to be able to focus on political activism full time. And so I'm I'm an independent, learn as I go, health justice activist.
Okay.
That is to kind of unwind the issues that I saw and that were playing out at the hospital where I was working.
Excellent. Excellent. You just said, I quit. I'm done with this. I dig it. So to kind of kick off our conversation, I want you to give a bit of a definition and what it means historically in terms of what institutionalized or systemic racism is, then kind of attribute it to what you were experiencing and what is kind of going on right now in the pandemic.
Mm-hmm. Yeah, so institutionalized or structural racism is essentially like anything or is just systems or institutions play out in a way to systematically disadvantage one race under another. And so structural racism does not need to have a racist intent. So politicians could decide to pass and enact a policy, and it may have never crossed their mind how it could affect Black people. But if it ends up having a negative effect on Black people or a Black community, then it is therefore structural racism. In New York, however, it is the intent does not have to be specifically racist, but what I found out the more I learned about the policies that were affecting us at SUNY Downstate is that many of them had an origin in interpersonal racism that later played out at a structural level. So the biggest issue disadvantaging SUNY Downstate is that public insurance pays much less for care than what private insurance pays. And so if you have a hospital that serves a disproportionate amount of people on public insurance, the hospital itself is getting so much less money back for the that it is providing that there's no way they can keep up in providing the same type of care that a hospital that is being paid twice as much money to provide that care is able to provide. And when we look, well, why do we have public and private insurance to begin with, where most other industrialized nations have a national health insurance program? Well, when that was a discussion in the United States in the 1960s, the American Medical Association came out strong against nationalized health insurance. Why? Because it was a segregated white organization. They did not allow Black doctors into the AMA until the late 60s, early 70s. And the exclusively white membership of the AMA didn't want to have to take care of Black people. And so the first time the AMA collected dues from their membership was to finance a lobbying effort against national health insurance so that they would not be forced to provide health care to people who they had malicious racist feelings towards. And so while today we often don't see public and private insurance we don't see it as necessarily a racial issue. The reason why we have it in the first place is because of the racism that has existed with us since we created it as an excuse for slavery. We come up with a reason for why slavery existed. So developing a mentality where a group of people are worth less than another group of people was not a part of every society. It is something we intentionally cultivated in the United States to justify slavery. And then when slavery went away, that same racism stayed with us and then has influenced many of the policies and practices that that influence how care can be provided on the floor in a hospital.
Great. Whew. Speak on it. You're dropping knowledge. You're dropping knowledge on it. You're dropping knowledge on it. So what kind of things did you see in your experience when you were a nurse? I understand you have the statistic, but experience-wise, what kind of things did you see in the hospital?
So just constant and extreme understaffing, just always having one more patient than what I was supposed to have is kind of the baseline issue. I often say it is more a problem with who isn't at the public hospitals than a problem with who is at the public hospitals. But as why understaffing is such a problem is that, if a nurse is given 2 patients and each of those patients require about 8 hours of hands-on care, but it's a 12-hour shift. So what 4 hours of care are you going to decide a patient won't get, And then what if they throw on a third patient, And so the needs of the patients haven't changed. They need exactly the same amount of care, regardless of what fractions of a nurse attention they have. And just the, if I have 3 babies when I should have 1, that means I have to compromise the care I'm providing to every patient that I'm caring for. So it means that, I should be taking their temperature every 2 hours to help monitor it carefully. Well, if I'm busy, then I'm not taking their temperature. So what if they develop a fever, or if they're too cold and I'm not catching it and intervening in a timely manner? A lot of those, like the things you're supposed to do, 1 out of 10 times something bad will happen, but that's frequently enough that every time we should be doing some assessment to make sure it doesn't happen for our babies. Well, when you're understaffed, you just stop doing the assessments. That's 1 out of 10 because you don't have time, and then it will eventually kind of up. So kind of like the one event that radicalized me most is that I had sent an email to my bosses saying, we're incredibly understaffed, things are dangerous, I'm not able to complete my responsibilities for my patients. What are we going to do to get more staff? And I never got a response to that email. And less than 24 hours later, a mother died of preventable causes.
Wow.
She was in our NICU. She complained that she wasn't feeling good and wanted to go back to her room. And she waited over an hour and a half for transport to come and get her, because we had called multiple times to try and get somebody from a specific department in the hospital to come and bring her back to the floor. Usually, in a normal world, I have just taken her and not kept calling for transport, but we were so understaffed that I couldn't pay attention to the babies and also leave the floor to take a mother back. And then less than 2 hours after we went to her room, we started hearing codes being called on the overhead. And in total, they called 9 codes for this woman. And so for people who aren't in the medical field, the whole point of a code is you call it once, and all of the staff who need to be involved in the code show up. And certainly if you hear a code being called on the maternity floor, you don't take that lightly, because it's either a mother or a baby that is dead, right? So the 3rd time they called a code, my coworkers and I were looking at each other holy shit.
What's going on?
Yeah, anybody in this hospital that could potentially be helpful in a code situation should already be there. What is going on?
Mm-hmm.
So she what turned out was that the anesthesiologist never showed up to the code, and she ended up dying of a pulmonary embolism. And what is the first thing you would do if you have this medical complication is put a breathing tube in. Who's the doctor that's really good at putting breathing tubes in? Is an anesthesiologist. So the doctor we know could have saved her life just didn't come because he wasn't working there, because we didn't have the money to keep the number of anesthesiologists on staff. After that happened, so that should be the end of the story. That story's bad enough. After that, I sent 4 more emails up the chain of command, because I kept coming back to work, and we were as staffed as the day that woman died. And less than 4 months later, we never got more staff at the hospital. Nothing. The only thing that came from me from those emails was that I painted a target on my back for retaliation from the administration. And less than 4 months later, another mother died of preventable causes in our hospital. Mm-hmm. And what I didn't realize at the time is that as I was sending emails to the administration, the headlines in the news was Cuomo was cutting the budget to public hospitals and sending us all into hiring freezes. So we the reason why the administration was ignoring my emails was not necessarily because they were bad people who don't care about their patients. What are they gonna pay out of go into their own pockets to hire more nurses? If the won't give us enough money to run the hospital, it puts administrators in this very precarious position where they don't have the resources they need to do their job well. And in the same way that me speaking out about it has invited retaliation, they are similarly afraid of that retaliation were they to start speaking candidly as I have about those policies.
Well, yeah, that really brings us to a good example of what goes on the ground, as somebody was saying. How these policies from high up can cause these deaths, needless deaths. And to say this is happening in the United States, some people kind of close their ears off saying, no, you know, we're in the country of opportunities, we're one of the richest countries in the world, if not the richest. How could this be going on our soil? But it very much is in a disproportionate manner to Black and brown people in our country. And now, can you go into a little bit more of what you do on a day-to-day basis? You have been a star on C-SPAN, speaking a lot of these issues in political environments. So talk a little bit about that and the response you have been getting from the community and other politicians.
Yeah. So the C-SPAN appearances have been at public hearings hosted by the city and state legislative health committees. So occasionally they'll hold public hearings on one issue or another. And anybody can sign up to testify at these public hearings. So I kept my eyes open for them and signed up to testify. And it's an opportunity to tell the legislators who are partially responsible for these policies what is going on and how it plays out in real life. So I guess like on a day-to-day basis, it's been a lot of, the response I've gotten from going to see politicians is most of the local politicians representing Black neighborhoods of Brooklyn are very concerned about conditions within the hospital. Many of them have, really put a lot of their career into trying to bring more healthcare financing to the district. And so really are already out in front in the ways that we would want them to be, but are very reticent to air SUNY Downstate's dirty laundry. So SUNY Downstate is one of the, I think it's the biggest employer. It's the biggest employer in the district where it is. I think it's one of the biggest employers in Brooklyn. And a satellite hospital of ours was closed in 2012. And there is a huge fear that bringing any attention to care issues at Downstate may result in, instead of the state saying like, oh, I guess we need to invest in this hospital, instead of, I guess we'll close it. So when I've spoken to local politicians, their response to me has been essentially very concerning, but we're not going to pursue any policies against the hospital on the say-so of a white nurse. Go get the community support, explain what's happening to the community, and when the community asks our offices to address these issues, that's when we're going to do it. So that's why I'm so excited. STOOP55 invited me on G-Feed. Hi, community. Come get involved. But a lot of it has been, I was a volunteer with Ancient Song Doula Services, which is a reproductive justice-based doula agency in Bed-Stuy. So I was volunteering with them for the past couple of years, and they were really generous sharing their space. So I started hosting teach-ins to try and just get this information about the connections between policy and hospital conditions and health disparities, try and get that information out there, and recruiting volunteers and, concerned community members to get involved in the political need to change those policies and work towards a process of truth, reconciliation, and reparations as a framework to deal with the human rights violations that the state of New York has perpetuated at this hospital and has allowed to occur at this hospital that they run.
Excellent. Glad you are touching on a little bit of what we're about to go to next. I still want people to get the ability to ask you questions. So everybody watching, please type in questions for Katie while she's here so she can answer. In the meantime, as they start coming in, just going through the ones that have already been here, how do you suggest the community can get involved?
So if you want to get involved with like specifically the work I'm doing, check out my website, brooklyngrows.com, and fill out the contact form so I have your email. I'm sending out updates. I host a Twitter Tuesdays at 2, where we do like an interactive Zoom action.
Okay.
Try and get in touch with different politicians. And then on Wednesdays, I have volunteer onboarding, where I just say like, who are you and how can you help? And we chat about what getting involved looks like. Like just in general, the state of New York, we are one vote away from passing Medicare for all in New York. We are one vote away from bill at the state level, which would enact universal guaranteed health insurance. So if you don't want to work specifically with me, I would look up the Campaign for New York Health and really like get involved in the push towards getting this bill passed. Like, well, we're only one vote short. We could pass it tomorrow. It has a 4-month enrollment period. So like 4 months from now, every New Yorker could have equitable health insurance. And the main mechanism by which we are dividing people and driving disparities, we could get rid of that by getting involved in activism for the Campaign for New York Health. So I would say, yeah, follow me on my socials, give me your email, and get involved with the Campaign for New York Health.
Great. Going through more of the questions. Another somebody said, Official C. White mentions, what can people do if their or their loved one is in a known underserved hospital?
So, that there's not a great answer to this. There is research that one of my mentors, Dr. Donna Ann Davis, wrote the book Reproductive Injustice. And in her research, a common theme was that Black people who had an immediate family member in a health field were less likely to experience interpersonal racism. So if you have somebody in your family, like if you have an aunt, if you have a cousin, if you have anybody that works in healthcare, like let people know, have them come visit in their scrubs. It does change, like if you are under-resourced, you're going to focus on people who you know there may be consequences if something bad happens. And if we see that your family is involved, up on you. I keep a really careful of what is happening. You know, who's saying what to you when are the nurses coming into that room? Like make a written documentation of everything that is going on. And I guess those are the things off the top of my head, but just, try don't drop your loved one off at as much as possible. Stay with them, have family there visiting, and try to, make sure the staff know eyes are on them and how this person's being treated.
Got it. And going back one more, someone wanted to finish up the previous question you had. How do we get about getting that one vote? How do we mobilize these beautiful people on STOOP55 to get that one vote? Where should they be going or anything like that?
Yeah. So most of the holdouts, like the votes we need, there's one guy in Central Brooklyn, Simcha Felder, who represents a predominantly Jewish district in the senator on Staten Island, the senators on Long Island, and in the Hudson Valley. Those are kind of where they're located. So if you know people on Long Island, like if you know people in those geographic locations, call them up and have them call their own representative, because that's the most effect, the voices those are listening to most are the people who can vote for them. So think who do I know in these places, and how do I get them to get in touch with their representatives? And then also, calling their office. Join me on Twitter Tuesday, tagging them in posts about why we need to pass the New York Health Act. Everything we can to keep it in there. It's really a group of a very small group of activists that have been working on this law up until now. And so if we are able to expand that, and if, probably right now they're getting a call, 2 calls a week about the New York Health Act, if we could make it 200 calls, maybe see some action. So yeah, but I have a whole blog post on how to flip the last vote. So yeah, just learn. Yeah, asking them is mostly asking them a lot and often and making it an issue they can't ignore.
Excellent. I'm glad. I'm glad. Let's keep on moving. I see all these people have questions. They're saying, mentioning that they should write to their local senators. One more question is how do administrators report the unnecessary deaths? Is there a way to track this, which I find can kind of be very difficult from the physician standpoint. But what do you say to that? What have you been seeing, and how do we really manage this and bring this to light?
I mean, this is why it's so important for people who are not in healthcare to get involved. Why so much props to Stephen Gav for using their platform with STOOP55 to talk about these issues during the coronavirus. Why it's so important people who aren't in healthcare are learning about these things is because the people who are in healthcare have so much professional stake in speaking the truth that they are not. So the official report of the woman who died with the code being called 9 times, that official report says that understaffing played no role in her death. How? I don't know. I have an audio recording of the hospital administrator of my argument with her. How can you say that understaffing wasn't a part of the death? Here's the schedule for that day. We were understaffed. And she goes, oh, well, she was a maternity patient, not a NICU patient. And I was like, but she was those two things are connected. And there seems I think here's where we see kind of structural racism and interpersonal racism playing into each other. Is I think the administration has this well, Black women are much more likely to die in childbirth, so it's not our fault that our patients are dying at a higher rate. When the reason is that Black women are more likely to die in childbirth because they come to hospitals like SUNY Downstate. You know what I mean? And it's this trying to interrupt that logic of, the administrator saying well, we're serving an underserved population. They wouldn't get better care if they went other places, and having to push back on that and saying well, if we were providing good medical care,
exactly.
They're only underserved because we're the ones underserving them.
Serving them.
It's backward that's logic. And unfortunately, because unfortunately people are taking a lot of cover under thinking that it is race and not race. So racism and not race causes racial health disparities. There's nothing biologically different about Black people that would make them more likely to have negative outcomes. But unfortunately, if you have that twisted, and if you think it is race causing racial health disparities, then it excuses quite a lot of bad behavior on the administration or on the healthcare institution's part, and causes this cognitive dissonance where we know we're providing poor, worse care than other hospitals. We know all of our patients are Black, so that's going to cause population level healthcare disparities. But we still use the population level healthcare disparities as a reason. Yeah.
Whew! Gosh, Katie, as per usual, I'm so thankful you're on here able to talk to the people. Just to give a synopsis for everyone who joined us in the middle, this is Katie McFadden, a former registered nurse at SUNY Downstate, now a political activist going in on these systemic injustices. Also, I want to give a chance for Katie, just do you want to say anything to the people in light of this pandemic before we switch off and speak with our next guest? I want to give you a second to say any last words you have or anything you really want to be able to relate to our beautiful people on the stoop.
Just stay safe out there, stay home if you can, and let's get involved. I feel like I'm late to the party. I'm late to the fight for our collective liberation. But if you aren't already in the fight for our collective liberation, come join us, because there's quite a lot of work to do.
Perfect. Thank you so much, Katie. We appreciate it. We're going to put that on a t-shirt somewhere. Stoop, fellas, Steve, Gab, let's get it together. Take care. Katie, and we'll see you next time around. Keep fighting the good fight.
Thank you so much, Matt. Have a good night.
Take care. All right, that was the eloquent Katie McFadden dropping some knowledge with us. I really love her perspective on things, and definitely getting into policy and politics is really what's going to create the change. Even as a physician, I consistently treat patients that come into the emergency room, but all too often, I think physicians and people in general ignore the situations that cause the diseases in the first place, which is the external environment they're coming from. So you treat them in the emergency room only to discharge them back into the area that helped foster the disease process in the first place. And I think we can't lose sight of that. So what we'll do is bring on our next guest, Miss Farah Forrest. She is a prior field nurse and candidate of the 57th Assembly District. Farah, you can come on and press your lower button to get you on the stoop. Also, I want to remind you guys, we're still continuing our great fundraising for PPE for Brooklyn Hospital. We're trying to buy N95 masks. Just click on that link below at the STOOP55 IG page, and the GoFundMe's there. We're almost halfway there, so any little dollar, little cent will really be helpful, all right? All right, let's bring Farah on in.
Yes. Am I catching up?
I can hear you, but I can't see you as yet.
Oh, you can hear me?
Yeah, I can hear you, but I can't see you yet. So it's still working on it.
I don't know.
There we go.
Yes. Hello. Hi.
What's up, Farah? Welcome to the stoop. How you doing?
Thank you. It feels great to be on the stoop.
Please, please. This is a wonderful opportunity for our audience to get to know you and what you do. Do you mind introducing yourself?
So again, my name is Farah Forrest. I am a registered nurse. I specialize in maternal child health, and I do that in the home. So I'm not actually tied to a facility. I also am running for office. I'm running for Assembly District 57. That's Crown Heights, parts of Crown Heights, Prospect Heights, Fort Greene Park, Clinton Hill, and a little bit of Bed-Stuy. And so I've also been working a lot in housing advocacy. I've joined the tenant movement officially in 2016 when I was fighting back the condo conversion of my rent stabilized building. But my fight actually started way, way back in the day when I was 16 years old. And there was a question on why a bunch of these Black and brown people showing up with high lead levels at the hospital. And so I was part of the initiative that went out into the community and was like, hey, let's check your lead, let's check the paint on your wall, and let's talk to these landlords about bettering housing conditions. So that's my background a little bit.
All right, bringing representation out there. That's what I like to see, sis. All right, so talking, keeping a little bit more in mind with the pandemic going on right now, there's so many external factors outside of direct health, or leaning more to the social determinants of health, that affect people's health now during the pandemic, especially in lower socioeconomic classes. What are some of the factors that you're seeing that affect people contracting COVID-19 and how they do in the hospital in COVID, when they have the infection? Okay.
So my first experience on kind of understanding what these socioeconomics was my first patient when I was in nursing school. And this man came to the hospital with blood sugar of 600. I mean, he ought to be really sick. And when I got to talking to him, I understood that he worked 2 jobs. He was often eating unhealthy foods. And then when you put him in the condition of like Starrett City, you're then seeing that he is exposed to environmental pollutants every day. He has to travel on his job to his jobs, right? So that's already like stress. So we got to think about the mental health of this person, and the fact that 2 jobs with kids and a wife living in a 1-bedroom apartment, that I can assume, I don't never walked into it, but assuming from all the different homes that I've walked into Medicaid recipient, of Medicaid recipients, it's not the best, it's not the Hilton. Okay. So you're talking about black mold, you're talking about infestation, rats and roaches running around the place, and then just the idea of hot water not being on. And then you add on to the fact that 44% of my district is rent burdened. That means that we're paying more than 30% of our salaries into just the rent. So this person doesn't have savings. So if he's in the hospital for 10, 15 days because his sugar's so high, then we're looking at who's paying the bills. So that's just one snippet of some of the things that we can see when we look at, like how you say, when the patient walks into the ER, what is this patient walking in with, but where they coming from? And that's where I see most of the people that I've been working with coming from.
I see that. And I really, as I said, the pandemic has more effects on society rather than just the health, right? There are a lot of people that are out of jobs. We're talking about essential workers. It's brought up always about essential workers, but these essential workers are beyond healthcare workers, right? These are people very much involved in the supply chain. And then some people don't have to be honest, the luxury of staying home. How does that affect people when they're losing their jobs and stuff of that nature during this pandemic? And what have you seen?
So right now I'm part of the Crown Heights Mutual Aid. And what I see that this mutual aid has been able to do was just fundamentally address people at their most basic levels. I mean, we have elderly people who can't leave the house to pick up medications from the store, right? And then we're looking at people who would love to take care of their family members, take care of, however they were able to do before, but they can barely take care of themselves. Either they're sick or they're trying to prevent people from being sick. So when we talk about essential workers, I mean, I am literally walking in from outside after work, stripping off my clothes at the door, taking off my shoes, running to the bathroom, taking a full shower in hopes that from the door to the bathroom, I didn't, breathe something that I caught from outside. So, and then you're adding on to the fact that, a lot of people have the luxury of working from home, but some people got to hit the pavement to get their paycheck. So if you're talking about the MTA, maybe you're a security guard, or maybe Target lets you come in to do, stock them apples or stock the floors. Yeah, sure, great. You're still able to get some kind of income at the risk of your friends and your family and yourself. But then what about the people who are not working? My dad is a taxi driver. He's been sitting here since March 20th, just not earning any type of income. And had I not did what I did to be here and help him out, he would be not able to pay the rent. So that's evictions, that's eviction notices, that's housing court, and that's the explanation. That's more days off from work. So this is really, we're talking about the time that we're staying home right now, but the time to recover both physically, mentally, and then economically from all of this is ridiculous.
Yeah, I see it. It'll extend and pass it, especially since a lot of states are talking about lifting quarantine. I don't think New York is anywhere near it, but you're putting everyone else in danger, right? And it's preferably these Black and brown communities that are suffering already. And by lifting these restrictions, you're going to overwhelm the hospital system and really extend the pain from this pandemic in the first place.
Yes.
In general, what are some of the discriminatory policies you've been coming across and trying to change in your own district?
So when it comes down to discriminatory policies, I mean, when we talk about housing, because I'm a housing advocate, we have some policies that allow developers to develop a property and say that, the policy says that they have to allow some affordability, right? So if that affordability is allotted 30%. That means that 70% of that building is unaffordable. And I really find a problem with that policy because if we are the people who are already in the community, right, Black and brown, Latino people, right, then why are we allowing people, developers, to then have us fight over scraps? That doesn't make sense to me. And so one of the things that these policies they come about is because at the end of the day, real estate and the corporations have bought out our elected officials. They have bought themselves into these policies. I mean, I, as a candidate, say that I refuse to take corporate dollars or real estate developer money, everybody's like, well, how do you think you're going to make it? Well, with the people, of course. I mean, the people. Hello. How's Bernie Sanders making it? With the people behind him. So it's like it's something blowing their brain. They can't figure it out. But it's because the establishment has been so driven on the idea that you win campaigns by making dollars. And the developers have a very hefty investment put into these communities. East New York, Brownsville. It's all been written out for years. We did not lose hospitals out of the blue. Systematically, over 20 years, I have seen Caledonia. Interfaith has shut down parts of its units. Jewish Hospital, Lich, all of these hospitals have been systematically cut off for the last 20 years. And then now we're sitting here like, oh, we're short by 20,000 beds. Where did they go, Governor Cuomo? I wonder.
Okay.
All in the name of what? For profits.
Exactly. I really like that you're speaking to this specifically, especially talking to the people saying that we have value in this state. We have a lot of value in this state. What can the people do from their perspective? Katie kind of touched on it in her own, but I want to hear from you. What can the people do to elicit this type of change in their community?
So Katie talked about joining the campaign for New York Health. I want to bring it a little bit more basic than that, right?
Sure.
It's time for us to stop complaining and start getting active. A lot of people are praying on their knees, but they're not praying with their feet. As Frederick Douglass has said, it is time for us to start taking matters into our own hands. I'm part of this Crown Heights Mutual Aid, and I'm telling you, people putting up receipts from supermarket, Whole Foods. You know Whole Foods ain't cheap. $120. Yo, bit by bit, $5 here, $10 here. That whole receipt is covered. Now imagine if we put that same mentality, that same idea that we got to pull ourselves up by the bootstraps to what we need to things like New York Health Act, safe staffing. We have other bills. Cut this 428 allotment for rich people to make. We could talk about that. I got on a bus with a couple hundred nurses, about 100 nurses. We got on the bus to go to Albany and tell these people, listen, when we talk about safe staffing, it's not because we nurses care about necessarily having easier shift. It's about patients will die if the nurse isn't there to see. And Doc, you could agree with me. Nurses catch 80% of medical errors. So if I'm sleepy or I haven't had my break yet, and I got 12 patients to, somebody slipping, we slipping. So when we have people understanding it, and people just don't say there and be like, well, I got to go to work. I made that mistake before. Before I became a nurse, I was an Uber driver. I was cleaning toilets. I was working at Target. I worked at Dr. J's. And it never clicked in my mind during that time that my liberation is literally in my hands. Once I make the decision to walk out, that's it. Once I make the decision in my mind and in my actions, walk out. I've been doing housing tenant work for a long time. I've been doing it on my weekends. Instead of sitting at home watching Housewives of Atlanta I just put in the work. That's it. And it's just made more sense to me now as a nurse who's running for office. Nobody wants me to run. Nobody wants me to run. I'll speak too much truth. I'll show up to the Capitol building in my scrubs. They don't want to see that. They don't want to see that. But it has to happen because it's not about just what's happening in Albany. It's for the people back in our communities so that they see that once they say it's over, it's done, finished.
You get me inspired. I'm about to rise up out of my seat right now. I appreciate the energy. The energy. Of course. To mention to everyone who just jumped in here, we're speaking with Farrah Forrest, prior nurse and a candidate for the 57th Assembly District, speaking on what's going on in our community in relation to the pandemic right now. And I thank you so much for being here. We did discuss before we started the show, you wanted to take a bit to talk about reconciliation. And I really want you to give you a time to really fully express what that is to the people and what that means, what that looks like as well.
Okay. So this is something that actually Katie brought up to my mind, and in terms of like a way to fix our situation, and it is stuck in my mind. When we talk about the prison incarceration, that happened after the end of slavery, right? Where are we going to put all Black people, and we're going to put them in a mass incarceration system, right? When we talk about, when Katie had brought up the fact that we're not funding our public health system, is because we don't want Black people to stop dying from tuberculosis. Or even when we talk about the Tuskegee experiment, we don't want Black people to be cured. We just want to experiment. The fact that we have, I remember reading this book, Medical Apartheid, the fact that we have such big advances in gynecology, in obstetrics, is because they were experimenting on Black women. To this day, after reading that book, and then seeing women sign up, oh my God, you don't even want to try pushing that baby out, boo-boo. You are signing up for a C-section so that the insurance company and their stockholders can make money off of your Black body, beautiful woman. It pisses me off and it traumatizes me because for years and for decades, for hundreds, for centuries, our bodies have been put up for sale. And the only way we can really get to the root of our salvation is to have a truth and reconciliation period or moment, or how we're going to say, I don't know, council, because a lot of these truths haven't been spoken yet. Honestly, it needs to be acknowledged. It needs to be acknowledged, because when we're talking about this issue right here, even the idea of safe staffing. When you look at some of the most strapped hospitals in Brooklyn, we're talking about Coney Island, we're talking about Kings County, downstate, Kingsborough, the mental hospital. It's Black and brown women working to serve exactly, Henrietta Leaks, yes, Hunty, yes. All this cancer research needs to pay back payments. They owe payments to that family. Anyway,
I just want to highlight what you're saying in terms of the book you mentioned, Medical Apartheid. Everyone read that. Chris just posted the link. It's a really large history on the injustices that the medical system have done to Black bodies and Black people in general. This goes way beyond what we're classically taught in Tuskegee experiment and the history of that. It's much, much deeper in that. So I just wanted to plug that book really quick as you continue on. And I know where time is running out too. So I want you to please, how can people vote, and any other questions the crowd may have for our wonderful guest while she's here?
All right. So voting will happen on June 23rd, right? That's the big voting day. But there is an executive order that might throw out, we could mail our ballots in. So when you get the note, please don't treat it like how you did the census and toss it to the side. Please vote for me, Farrah Forrest, right? On the Democratic line. If you're living in my neighborhoods, but just vote for people who will truly carry your voice to Albany. Now more than ever, we need organizers in office, not career politicians.
Cool. So the people want you, Farrah. The people want you. You might have to go over a little bit, but does anybody have any questions? Let's open this up to questions we have while she's still here. And please, you can continue on what you were saying before.
Right. So just the idea that we need to really talk about this, because when I read the literature, they'll write it. Black women die from childbirth, but yet no one can give you an explanation. Oh, the woman just died, but yet clearly Katie had talked about how codes on a labor unit are not being answered. Women come to the triage room and they're like, I'm in pain. And the doctor says, well, you're not screaming like the white lady over there, so sit your butt down. Or the idea that from the time prenatal care, I see them all the time. They come in for pregnancy tests at Kings County, and then they say, oh, miss, I'm going over to Lenox Hill because Beyonce had her baby there. I said, go ahead, hunty, go. I'm going to see you later. Because I know once they finish with you and they finish getting that prenatal dollars and they start seeing that you actually high risk, they're going to send you right back to Kings County because they'll take that Medicaid dollar as long as it's cheap. Prenatal care, prenatal vitamins, no problem. We'll put the little sonogram and listen to the baby heartbeat. That don't cost much. But when it comes down to the mental, the nutrition, everything else that you Black women dealing with, everything that's going on in your world, when you come to really get down to care, they're going to send you back to Kings County. No problem. They'll send you. So that's why I see them. They come in and I'm like, are you going to go to Mount Sinai? Go ahead, baby. I'll see you in about 7 months.
The powers that be are saying we don't have a lot of time left, but
Yeah,
we
go
will
ahead.
try to bring you back. Where can people donate to your cause? I see Carlos put your link. Is that FarahForAssembly.com?
Yes, Farah, Phara, for assembly.com. Please, and not only just your bodies and your mind, whatever, put your money, please, in causes that will really help you out. Take that brunch money that you're not spending anymore. That's $25. Put it in the fund, okay? It's going to good use.
Thank you so much for coming on the Stoop, Farah. You definitely gave an invigorating speech, invigorating talk. I hope everyone really learns lessons from what we can do and be and how active we are in our own destinies. Thank you so much again.
Thank
And we'll
you.
keep in touch. And definitely, we might have to bring you back on one of these
Amazing.
next days. All right?
Thank you. Thank you.
Take care. All right, everybody. That finishes up our episode for today. It's our 5th episode now. Next week, we're going to kind of the law enforcement aspect of the COVID-19 with a police officer, sheriff from Georgia. What can they do as Georgia looks to lift their quarantine? Lastly, I want you guys to take a look at the link on the bottom. We're still raising money for N95s, still trying to disperse this information to our minority communities to be better equipped to handle this pandemic. Everyone, please stay safe. Remember, we'll go a lot further together, even though we are apart. Stay healthy and take care. Good night.